Hello and welcome to another episode of Ankura Edu Talks, where we discuss how pediatricians and specialists can collaborate together to give the best care for children. I am Dr. Preeti Sharma, Senior Consultant Pediatrician at Ankura Hospital for Women and Children. Today, we will be discussing a specialty that is pediatric neurology, which deals with conditions affecting a child's brain, muscles, and nerves. And together, as a pediatrician and a pediatric neurologist, we should work together to identify the disease early so that children can have the best possible outcome. Today, I have with me Dr. Amol Jadhav, our expert pediatric neurologist at Ankura Hospital. Welcome, Dr. Amol.
Thank you, Dr. Preeti. I'm excited how we can manage together and diagnose neurological conditions together, and why specialized care is important while managing these kind of cases.
As pediatricians, we are the first point of contact for parents for the children. And we see certain problems like developmental delays, seizures, frequent headaches, or we may say certain subtle changes in a child's behavior, in coordination, frequent falls. And it is important that we as pediatricians recognize these signs early and refer to a specialist pediatric neurologist on time. So, Dr. Amol, what are the most common neurological conditions you see in children referred to you by general pediatricians?
That's a great question by Dr. Preeti. I must say, I usually handle the cases. Those include seizure disorders, chronic headaches, migraines, developmental delays, hyperactivities, and behavioral issues, sometimes like muscular dystrophies and metabolic conditions. Those are the cases which I look on a daily basis. The important part here is important. Many of the condition we need early intervention, and that is why if we understand and identify red flags, the care will be better and we can effectively manage those kind of cases. As a role of pediatrician, always essential to identify those early red flags, and on timely referral we can manage together in a better way.
That's absolutely right. So, early identification of red flags and early referral help these children a lot. So, talking about this, I recall a case I recently referred to Dr. Amol. A 4-year-old child came to me with like subtle changes. The parents felt that the child is falling more often, the child is a bit incoordinated. They thought it is just clumsiness. But when they mentioned this to me and I examined the child, I thought there could be a neurological problem. I got few basic investigations done and the CPK levels of the child were high, and I sent them to Dr. Amol immediately. So, Dr. Amol, can you please walk us through how you managed this case and how early identification helped this child?
Yeah, that was a great case. Like I still remember that case when you refer that case to me. That child was a 4 years old, and he was not able to walk alone, and there was a difficulty in climbing upstairs. When I thoroughly examined the kid, as per my knowledge, there was some difficulty getting up from sitting position, and there was some weakness in the lower limbs and in the pelvic girdle muscles. So appropriate testing is required was required at that moment. We have sent for the genetics, and later it found to be limb girdle muscular dystrophy, which our clinical and genetic diagnosis was going hand in hand, and then we managed effectively. Now the child is doing well. We have started on neuro rehabilitative services on a proper care. Along with that, a few medications also will support those children to do their work better. Along with that, we have to take some additional vaccines with along with our routine immunization schedule. I think I have referred that case back to you for additional vaccination also.
Yes, so this is a perfect example how pediatricians and pediatric neurologists can work together to improve the outcome of a child and why early referral is critical. Many times parents feel, oh, this is just a phase, my child will outgrow these symptoms. That's a wrong thinking. And as pediatricians, it's our duty to identify the warning signs and refer on time. For pediatric neurology cases to be managed effectively, we need cutting edge technology and treatment. So, Dr. Amol, can you just tell us what recent technology and what diagnostic tools you have available here in Ankura to help these children?
So for pediatric neurology, we have a routine EEGs, prolonged video EEG monitoring to diagnose true and false seizures. As well, we have nerve conduction studies available to diagnose nerve and muscle conditions. Along with that, we have a neurodevelopmental assessment for autism and hyperactive children. Along with that, we have a multidisciplinary team including developmental pediatrician, psychiatrist, behavioral therapist, and psychologist.
So that's wonderful. So children who come here can get everything done from initial assessment by a pediatrician to detailed evaluation and treatment by a pediatric neurologist. For management of pediatric neurology cases, we need cutting edge diagnostic tools and treatment options for these children. So Dr. Amol, can you quickly tell us that what recent treatment options and diagnostic options are available here in Ankura for these children?
Yeah. So we have routine and video EEGs available at our center. Those are routine EEGs as well as a prolonged video EEG to diagnose true and false seizures. Along with that, we diagnose epilepsy syndromes with the help of video EEGs. We have nerve conduction studies to diagnose nerve and muscle conditions. We have Botox therapy for cerebral palsy children. We have multidisciplinary team including developmental pediatrician, psychiatrist, psychologist, and speech therapist.
So that's wonderful. So if a child comes here, they can get everything done right from an initial assessment by a pediatrician to advanced treatment by a pediatric neurologist and all the tests. So this makes things very easy for parents also to get everything done under one roof, and it makes things simpler. Let's talk about how a general pediatrician can pick up and diagnose neurological problems early. Also, it's very important that parents know that what are the warning signs in their infant or their child when they need to approach a pediatrician or a pediatric neurologist. So Dr. Amol, can you quickly guide us about that?
Yeah, for infant, we should look for a social smile. If social smile is absent by 6 months, if the child is not able to sit alone by 11 months, if the child is not walking by 1.5 years, if there is a poor muscle tone or increased muscle tone in the form of stiffness in any of the limbs. For older children, if there are any behavioral issues, chronic headaches, frequent headaches, migraines, or any abnormal movements or seizure-like activity, those are the time when we should look for a pediatric neurologist.
That's incredibly useful for parents as well as general pediatricians. Now, Dr. Amol, as a pediatrician, I get many children who come to me for complaint of headaches. Some of them are very non-specific. So when is a headache significant and when should we refer to a pediatric neurologist?
If the headaches are daily morning headaches, or the headaches are disturbing the sleep, or because of headache child is not able to go to the school, or at least twice a week headache which is not explained by any other causes, so those are the times we should look for a pediatric neurologist for appropriate care and management.
Let's do a quick question and answer round with Dr. Amol about the common questions parents have about child neurology. The first question is, does every child who has a seizure means that they will have epilepsy, or do they have epilepsy?
Yeah, actually, there are not all seizures are epilepsy. Few seizures are triggered by fever. We call it as febrile seizures. So those are not epilepsy.
Does screen time cause developmental delay in children?
Excessive screen time will impact speech and social skills. So we usually recommend to limit the screen time for better growth and development.
Can migraines in children be prevented?
Yes, proper hydration, good sleep hygiene, nutritious food will reduce further attacks of migraines.
Does every child with delayed speech have autism?
Autism may be associated with speech and language delay, but speech delay isolated may be due to different causes like hearing issues, lack of stimulation, or sometimes underlying epilepsy also cause speech and language delay.
So the final question, what's the best way to improve brain health in children?
So we must encourage physical activity, good sleep hygiene, proper hydration, limiting screen time to have a better health and better brain growth in children.
Dr. Amol, this has been such an insightful discussion, and often parents don't realize the importance of early intervention in child neurology. Thank you so much for sharing your expertise with us.
Thank you, Dr. Preeti. My key message to the parents is early evaluation is a key. If you feel anything unusual in your child's development, please don't hesitate. Feel free to visit to your child neurologist.
So early evaluation can make a world of difference. If you have any concerns about your child's neurological health, don't hesitate to reach out to us. So thank you all of you for tuning in to this episode of Ankura Edu Talks. Stay healthy, stay happy, and catch us next time.